Stephanie, just tell me one thing. Like now, this is your third day after surgery. So if you compare when you were third day after band, and this is third day after second revision surgery, which is MGB, do you find any difference in drinking or in whatever you're taking in, your nausea, vomiting feeling, or is it almost the same?
Well, during my lap band, it wasn't actually so bad actually. It was just liquid diet, so I was traumatized. I wanted to eat. And I couldn't have anything. Now I can have more variety. I can have soup, I can have juice. Then I just had only water and apple juice and jellies.
I'm sorry, when you had the lap band, you had to drink liquids for how long?
10 days.
Okay. And here, you could start eating a little bit of soup and softer foods soon?
Yes, well, pretty much I could have that after 2 days.
Yeah.
But I'm not pushing it because technically I had the band before and then the MVC, so I still have a bit of scar.
Yeah, it's a revision surgery, and we know revision surgeries are, a little bit complicated. There's more leak rate associated with the revision surgeries. But in my practice, I have seen if we are doing MGB or anything else, because it's a low pressure system, and now it has been documented and established by various studies that it's a low pressure system, the chances of leak are less, but still we should be a little bit careful. And like our fresh patients who are primary MGB patients, we start them with semi-solid foods right on day one. So, Dr. Rutledge, what do you want to say about this?
Well, I think that one of the things that we could talk about is she mentioned something that we often hear, especially from band surgeons, and they say, well, you are cheating. In other words, there is some people who still believe that the band is a good operation, but that it fails because the patient is bad. So they do not blame the surgery, they do not blame the surgeon, but they blame the patient. They say, well, we have given you this great tool, but it failed because you failed. And I would like to argue, and if you wish, describe the details of why, in fact, the band fails, not the patient. So what we see is that when you put in a tight, narrow connection, whether it's a band or a sleeve or a Roux-en-Y, if you try to eat healthy, if you try to eat a sandwich or broccoli or a chunk of apple, in other words, you honestly and honorably want to eat a healthy diet, but when you try to eat, vomiting and retching and pain and discomfort. Contrary-wise, if you drink a Coca-Cola or ice cream or chocolate, it goes right through that tight, narrow area. So you might say, well, all you have to do with a band is never eat junk food, but you can't eat healthy food, and the diet desire, that is your appetite, remains the same, and in fact gets worse because you're starving and you can't eat healthy. So you eat bad food against your wishes, and it's not, in my opinion, the patient's problem, it's the operation itself. It is not effective. And we heard, actually, for many years, Australia was filled with successful lap bands, and now we know that was not true. Australia, the last bastion of the lap band, and now all around the world, the lap band is shown to be long-term, primarily a failure. And that's what happened in you, and not that you cheated, it was the operation that failed you.
I think you're very right. This is, I have seen in my practice, if I make a tight pouch, may it be sleeve or a band or a Roux-en-Y, it takes away patient's luxury. You are restricted too much. And if we restrict too much, that means you are bound to cheat. You have to have something. It's a law of nature as well. This applies to any field. If you restrict somebody too much, that person will try to cheat. It's not like you are cheating it. Basically, that procedure which is restricting you too much because your brain wants to have something.
And I think cheat is a bad word. I don't think we should use the word cheat. Cheat implies that there's a moral component. Look, if I breathe, if I hold my breath and stop breathing, I'm not going to cheat when I start breathing. You must eat and you must breathe. And when you say, I'm going to stop you from eating healthy foods, then you eat sugary junk foods, that is pathologic eating. In other words, the lap band induces a sick, abnormal, damaging type of meal. You can't eat a piece of broccoli easily, or a sandwich easily, or an apple easily, but a milkshake and junk food go down easily. So I feel very emotional when people say, I was accused of cheating. That is not a moral, it's a failure of the physiology, the anatomy of the band.
Right.
Wow. True. Okay,
Yeah.
so I didn't cheat.
You did not cheat.
Great to know.
Now you try to cheat this MGB, we'll see.
No. But let's talk about that. Let me explain the difference. If you take some sugary drinks, say Coca-Cola, ice cream, or chocolate with MGB, something different happens. What you will find, if you're like my over 6,000 MGB patients, you will find that a spoonful of ice cream is good. That's fine. It's acceptable. Even maybe a half a cup. But if you eat more, then the MGB will speak to you.
Right.
Very strong. It will say, no, 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 no sugary, sweet, liquid calories, or greasy, fatty meals. So broccoli or a green salad, yes. Yogurt, yes, but in small amounts. And then, if you go above that, the MGB will tap you gently and say, stop, stop. And then if you don't listen, it'll give you a little punch in the tummy and say, please stop.
Right.
Yeah, basically it's a combination of moderate restriction plus decreased absorption, or we can call it malabsorption, and you are eating right away into your intestine, and the behavior of the intestine decides what kind of foods you will be liking. Now the behavior of your tummy is not the same as it was before. So this is a little bit of poking from the MGB, which is a kind of blessing disguise, which keeps you away from the bad foods. You can eat because it's not a mechanical obstruction. There's no tight band. But you will not like to have too much sweet things, like, you can take half a cup of ice cream, but if you take 2 cups,
No.
for once it will allow you. But after 15-20 minutes,
No, you'll be very sick.
yeah, you have palpitation, sweating. That's what's called as dumping.
Dumping syndrome.
That dumping is the blessing disguise.
And that's also why the ideal diet is very easy to see everywhere on the internet. It's called a post-gastrectomy syndrome diet. It's an old diet we've had for years, and it means like this: 6 times a day, small meals, not so much sugary calories, not really heavy. Mama, father, both are medical doctors. They will know this immediately. Oh yes, 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 post-gastrectomy syndrome. That's what you have. You have this impact on your diet. We measure what our patients eat. We find that preoperatively in America, they drink sugary drinks and fatty meals, and afterwards, no more. Now, fresh fruits and vegetables in their diet goes up, processed meats go down, and yogurt goes up, and those things feel good in the stomach. And particularly sugary sodas and fatty, greasy meals, very upsetting to the stomach. So as you grow into that, you can look and talk to other MGB patients. They will all tell you that eating a healthy diet, basically a Mediterranean type diet we call it, is a very, very good way to eat with MGB, and 6 small meals instead of 3 big meals.
Right.